everybody. Today for Detox Month, I want to introduce you to some of the adjunct therapies that we use in our clinic to help you get better. Today we're going to talk about colonics or colon hydrotherapy, and we are currently in Pathways to Health clinic wellness spa, and we have Devra Lindsay here, and she is a colon hydrotherapist, and she's going to talk about what this procedure is and what will happen if you come here to receive this therapy. So, Devra?
Thank you, Dr. Wells. It's really an honor and a privilege to be a part of this journey, your journey. And welcome, everyone. So, well, let's go ahead and get started, and we'll head into our Aqua Spa Therapy 1 room.
Fantastic.
Okay?
Show the way.
All right, right this way.
So why don't we start by discussing what is the difference between a colonic and an enema?
An enema. It's a great question. An enema, and that is something that has been used for many centuries, in fact. I remember it growing up. It was a way to take care of the colon. The difference between the process of the colon hydrotherapy, also known as a colonic, is that an enema is only accessing, and let's take a look at this chart right here. The enema itself is only accessing probably the lower quadrant, the sigmoid, and if somebody has experience in the process of enemas, maybe the descending, which you have about 1 foot. Now, the average length of a colon is going to be 4.5, 5.5, and in some cases even greater than. So there's a whole lot left that the enema itself is not going to access. The process of the colon hydrotherapy, we have access to actually all that is there. And when we educate our clients about that, we talk about it as in, and looking at the chart, this is the colonic of the day, and in this direction, which is the natural flow, this is the yesterdays and the yester weeks. That then gives us access to the yester months and the yester years. And people don't realize just how much volume we can actually hold in waste. So there's a tremendous difference between the process of the enemas and colon hydrotherapy. And when people get to know this process, they sometimes refer to it as the Bentley.
So explain the purpose of a colonic. You kind of started talking about the yesteryears. Explain what the colonic does and why it's important.
Well, the importance of it, if we go back to the education around the nature of the colon itself, what goes in should come out. So based on how many times a day we're eating is how many times a day we should be eliminating. Right. And, on average, people say they eat 3 times a day, which we both know that we actually should be eating even more than that. But we'll talk about that relative to the average in 3 meals. The elimination process for the average individual is probably once a day. Now, technically, that is still considered constipation. And we have a lot of clients that have found their way to us, believe it or not, that are going to the bathroom once a week.
Yes.
Once a week. Now, 70+%, 80% of our immune system, which looks after us to make sure that we stay healthy in life and we don't get the flus and the colds, and far worse, any kind of a diagnosis, 80% of the immune system that's looking after us belongs to the sewer system, which is where disease starts. How profound is that? I don't believe there's an accident in the way that we were designed. And if that's the one thing, and we really pride ourselves on the education that we provide to our client care, is really think about that for a moment. Wow, okay. So the immune system belongs to the sewer system. I think that then we're going to press pause for a moment before we put something here, and even when we speak. There's a fascinating article on our website, and I know that it's something that you and yourself you integrate this into your care that you provide to your patients, and it's the gut-brain connection.
Very true.
And there's so much focus on that now today, which is so important for all that we do collectively. There's an article that was written many years ago by Dr. Gershon, if I'm pronouncing his name correctly, an MD, and I really believe that he was probably one of the first ones that had the understanding. And in that article, it talks about that the gut has a brain of its own because it has a separate nervous system.
Yes.
And serotonin and neurotransmitters that people think about here is actually right there. Wow. That is extraordinary. So the benefit of the process of colon hydrotherapy is exponential. It's exponential.
Okay, so why don't you break it down to what is actually happening?
It's a flow of water that's entered in very gently and very gradually. And as the water moves in through what we refer to as a closed gravity flow system, disposables are used, the water moves in and it makes its journey up the descending side, and when it meets the natural fluid content that is there, there is a what we refer to as then the river starts to flow. And then the matter itself will move through the closed tubing and it goes right across the viewing. And it's not a painful process, and nor should it be. If someone were in a situation where they were experiencing something like that, it should be, well, you're going to feel like you have to poop because you will be. Yeah. The amount that you're able to eliminate during the process, and then you have what we refer to as the table releases. The therapist is gently supporting the peristaltic rhythm with technique, and the table releases are then what give them access to what comes next, which is their toilet releases. So here we're gently supporting peristalsis, but in there, it is all their peristalsis. So that's a very, what we refer to as a sacred bonding moment, because it's an exercise for the colon, because there are times when the elimination that comes as a result of what happened here is incredible. And that's not something that would be typical for the bowel movement that we would be used to experiencing when we have one. Because sometimes people have a bowel movement and it's like a couple marbles.
Right. It's not a real one.
It's not a real one, yeah. And so the volume that's released, if that's what the colon is going to continue to release and let go of, is that it's almost like you're at the gym and you're exercising that muscle.
Yes.
So the process in itself, too, going back to that, is that this wonderful process, because we refer to, welcome to your personal trainer, your physical therapist, to bring the colon back to its place of timely elimination. So in effect, just like when we go to the gym to lift weights to change the shape of our body, you can, in fact, you can retone.
You can exercise.
You can exercise the colon muscle, and you can bring it back to, if you look over here for a moment, when we're born, this is the way that our colon is supposed to look. These are actually x-rays that are taken, and this is the way that it can end up, which can look a little bit intimidating, but it's not an unusual thing because it's a muscle. So it expands and it contracts. There are different reasons why something like this occurs. Briefly, well, we have found ourselves living in a chemically laden, artificial process world, haven't we? Yeah.
Yes. So if I could just clarify for my patients, a few of them were probably lost. And so with the tubing that she's referring to and the releasing, there's tubing that's inserted gently rectally, but it has two systems of tubes in one insertion, and one allows the saline water to come in gently. It's body temperature and cleanses everything until there's enough distension that you feel the urge to release, and you would tell her, and then she releases a valve that lets the other tubing allow evacuation while you stay on the table and you're very comfortable and don't have to make multiple trips to the bathroom.
Yes.
That's the main part of the procedure, and the final evacuation is in the bathroom. So I just wanted to clarify that.
Yeah, absolutely. Yeah. So it's a very gentle process. It's a continuous flow. Water moves in and the matter moves out. So
Yes.
There can be moments when things are really shifting and moving in the different quadrants of the descending, the transverse, and the ascending. And when that comes through, There can be some cramping that's involved, but it's not anything that is not easy for them to embrace. Yeah.
Yes. Yeah. Okay. Very good. So the risks of this, well, I don't know if we even really went into it clearly, but the matting down of the fecal matter, you were talking about yesteryears. I wanted you to kind of explain that term of how the matter builds up on the colon walls and the problems physiologically that leads to.
Which can be exponential. And, the time or an age would be relative here is somebody that finds their way to us that's in their 50s is going to have more accumulation than someone that's in their 20s.
Right.
And, the longer that matter has been in there, it becomes more dense. Mm-hmm. And the function of the colon, hydration and elimination.
Right.
And one of the things that can be confusing to clients sometimes is when we say, your colon is showing signs of dehydration. Well, but I drink so much water. Mm-hmm. And the water is the fluid of life, which is very important, but the hydration of the colon itself is, of course, in the lifestyle choices that we make around the fresh fruits and vegetables that we eat. All of that factors in. In our collective experience here, and we've been providing this care for over 20 years, and is that it's not something that somebody that has those yesteryears that you're asking about is going to be able to eliminate on their own, even with the best probiotic.
Yeah.
Which we understand the importance of that. Mm-hmm. This is the process to be able to release that. So going back to the dynamic of the relationship between the immune system and the sewer system, mm-hmm. People can research this online and say, that just sounds like a good idea. That makes sense. Because of that dynamic marriage is what we refer to it as the immune system and the sewer system, it blows good idea out of the water. It's what the colon wants and it's what the colon needs. Right. And when somebody is able to release the yester months, weeks that gives us access to the rest of it, mm-hmm. it changes the dynamic of everything, and you've touched on so many incredible things, and we're so passionate around here about the care that we provide, and we want for people to have this understanding. If those toxins are not moving out in a bowel movement, they're going to recirculate. Right. They recirculate, and
not only that, but locally leading to colon polyps and leading to, because of the irritation and the dehydration and the toxins and the colon cancer.
Exactly, and that is something that, of course, we don't ever want to hear is a diagnosis. This is the very best. It's one of the very best anti-aging that I can begin to imagine, because the skin is the largest elimination organ, and when toxins are trapped on the inside, one of the primary ways they're going to try to escape is through the skin. If we, mm-hmm. We would, it's prevention. It's
our internal skin.
Yeah.
I think of it as, if you live in a house for 20 years, 30 years, 50 years, and you only vacuum the carpet, but you don't do that deep cleansing with the water, where you're just really cleaning up all what's matted down in it, and that's the difference between a normal elimination or even an enema versus doing colonic therapy.
Oh my gosh, absolutely. Yeah. That's a great analogy.
Yeah. Well, tell me more about, we talked a lot on what the external experience is. Not very painful. It goes with your flow of your body. You are very good at reading that. And I think another concern my patients have is that it's going to mess up their gut flora. Can you talk about that?
Right. Yes, that's a great question. Within the colon itself, there's a free radical block party going on in there 24/7. So you have a dynamic relationship between the friendlies and the unfriendly. And so during the process itself, yes, there's no way that you can say, okay, all you good guys go over here to the descending side and we're just going to address, well, that's not going to happen. So yes, you do have both that are released as part of the process, but it's important to release the unfriendlies so that the foundation of the good can be just that. What's important, though, is that we supplement with a great probiotic strain of some kind on a daily basis. Now, that is something that we provide as part of our care because of the very little water that is actually used during this process. It is not something that's going to take away from, but the providing the education for people to understand, again, going back to the chemically laden artificial process world that we live in, we should be on a probiotic of some kind every day of our life. And I am sorry, but you're not going to be able to eat enough Activia to get the kind of probiotic support that you need. You know, it needs to be supplemented. Right. And digestive enzymes as well should be taken on a daily basis for that very reason. So the questions and concerns that we often find that people have is it's going to throw off the balance or depletion of the electrolytes is not true. There is not enough water that is used during this process for us to even come anywhere remotely close to that. And you'd literally have to have somebody, you'd have to be bringing a lot of water in and keeping somebody here, which you would never do. And that leads on to something that's very important. This is not a replacement for going to the bathroom.
Yes.
It is a gentle reminder so the colon can get back to its natural place of timely elimination, which is inherent. But when you have all that stuff in there, it holds back the peristalsis from understanding its wave-like action rhythm. Because it can't. There's too much junk in the trunk is sort of what they say.
So it's physical therapy, and then when the colon can move again, because it's not stiff from all this layers of junk, and when it's practiced flexing those muscles again, the muscle memory's there, and it works on its own. We don't need this therapy, you know, continually.
Yes, exactly. Yeah.
And I think you're right about cleaning out the environment so that then whatever's there is flourishing is way more beneficial to your flora than any few organisms you would lose during the process.
Yes. It balances itself out. It really does. But to do nothing about that kind of built up waste that people have in there, the best probiotic in the world is not going to be able to create a balance for that. It has to be released. It has to be released. Yeah.
Okay. Well, that was the other question about dependence. Am I going to get dependent? So I think we've answered that. The only other question would be, you know, how safe is this? Let's talk about any concerns that our patients need to have.
Absolutely none whatsoever. And, you know, this process has been around since before. I mean, the understanding of taking care of the digestive system and the colon really can trace it all the way back to biblical. Yeah. Now, the techniques that they used back there were very different. We're very glad that we are here now in this era of time to be working with such an amazing instrument that is very gentle in that process. But there is there's no you know, as far as contraindications, I'd actually like to touch on that. This is completely safe. Now, if somebody has been on a journey where they have had a resectioning of their intestine.
Yes, surgical procedures.
That is a no-go zone. Yeah.
Active ulcerative colitis or other bleeding lesions of the lower digestive tract would also be a reason. And I believe pregnancy.
Oh, yes.
For pregnancy.
Yeah, absolutely.
Okay. And tell me about the whole prescription thing.
The prescription. So in the state of Texas, it is required that clinics like ours have a medical director that oversees. They are not required by law to actually be on the premises. And when our clients come here for the first time, they do have the option to bring a prescription that you send your patients with.
Correct.
Or we are able to provide that. There is a fee. It's a $35 fee actually here for us. Right. That fee goes to our medical director that will cover for the prescription of the procedure of colon hydrotherapy.
Correct.
Yeah. Yes. And that's the law in the state of Texas.
I think that is all of my questions. Hopefully we've answered most of yours. You can see that Devra is passionate about colon hydrotherapy. I'm so thankful and grateful to have someone who loves this therapy and is there for all my patients, and because it is a very important part of healing for so many people.
And thank you very much, because this really is, as it is for you, this is our ministry of our life's work and the care that we provide. And I know that you carry that same heart. And we so appreciate you guys and what you're doing out there. So you guys are so lucky to have her. Okay. You are loved.
So sweet.
Thank you so much.
All right. Thank you.